Can you do me a favor, please? Come over here and just push record right there at the REC. Yes. All right, don't worry about it. I'll fix that later. Hi, guys. This is Charles. I'm one of the surgeons at the Animal Emergency Centre in Moorabbin, which is a suburb of Melbourne, Australia. We have this poor little dog that fell off a cliff at the beach and sustained a comminuted diaphyseal femoral fracture that we're going to repair with a plate. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. I did post the radiographs on a previous live stream just a few minutes ago that you can refer to, see what the fracture looks like. There is, it's basically a three-piece fracture as far as I can tell, with a large shard heading up proximally. So my first objective is going to be probably to reduce that, get it into a two-piece fracture. So reduce that with some cerclage wire, get it into a two-piece fracture, and then put a plate on it. Important anatomy close by, we do have the sciatic nerve, which will be caudal to the femur. We'll have to be aware of that. You can already see the bruising. If there's any doubt that we were on the right leg, or correct leg. So I'm going to go through the fascia lata, just cranial, to the biceps femoris. That's patella down there. All right, so I can see, might get into some gluteal muscle, superficial gluteal up here, tensor fascia lata. Okay, so that's through the fascia right there. Let's grab some Metzenbaum scissors. Suction turned on? Yeah, thank you. That's vastus lateralis right there. So it's kind of on the leading edge of the biceps femoris. So that's biceps right there. Have to be careful with how much retraction I get with the Gelpies, because you can cause distraction of the fracture, which can make it difficult to reduce. No, I don't have Cindy with me yet. She's doing a discharge for me, so I'm probably not going to be able to look at the questions on the live stream, but I will try to get back to them later. So just stay tuned. Very swollen muscle here. I did get a quick look, and I could see somebody asked about the ground plate. Ground plate that we use is a kind of a rubberized dispersion electrode. Okay, so that's our vastus lateralis up there. And this is not active bleeding for the most part. This is just hematoma. So I can feel the greater trochanter up here. Just get an idea of the amount of trauma that's happened here. So that's the distal femur right there. So that's just all damaged muscle there. And that's the adductor muscle that's on the back there that can help us with our alignment. Can I get some smaller bone clamps, please? Yeah, thank you. And then we have to find that other fragment in there as well. We do purchase our grounding plate from a regular vet distributor. Okay. I'm trying to find that bone clamp that, oh, I've got it on the proximal segment. Okay, so got that released there. Now I'm trying to find the other shard of bone, which I think is just sitting right in here. And as I'm manipulating it, I don't want to devitalize it or But it is sticking right down here. I also want to be careful with that fragment so that I don't splinter it further. Our sciatic nerve is right back here. So I can actually feel it right back there, so I have to be really careful with that as well. All right, so can I get another one of these, please? Yeah, just like that one. I have to expose this proximal femur a little bit more so as to allow me to get the alignment. Yeah, that's it. Thank you. I'm just exposing a little bit more up on my greater trochanter. Thank you. The patella is right here. Right up there. Okay, so that fragment is going right up proximally. I know that I'm not supposed to stick my fingers in fractures if I can avoid it. But I really want to make sure that I get that aligned, because reestablishing that cortical continuity is what's going to provide a lot of stability to this fracture. See if I can grab onto that greater trochanter and rotate that around a little bit so that I can see where that fragment is missing. Cindy is here now to save the day. And I've certainly had fractures where I'm repairing them, and then suddenly you hear a big crack, and you've splintered off a piece of bone that you're trying to preserve. I think that's going to come all the way down here, like that. Something like that. Kind of hard to do by myself. So I'll get a bone clamp all the way around. Let's see, I can feel it. Just being careful for my sciatic nerve back here. I'm going to have to pull that distally in order to get it to fit in the hole. Okay. So, Cindy, I've got my main fragment here, and then I've got a big shard, which is medial here. About right there. So I have to get that into position first. Just hold still with what you've got. And so we've got a lot of adductor muscle attached to it, which is good, but it does make it harder to reduce. Not sure exactly how this is going to fit in here. I wonder if there's something missing. Maybe this needs to rotate around and fit all the way down there. Okay, so what I'm going to do temporarily so I'm just going to leave that there for a minute and think about what I'm doing here. That's okay. Wish I could just, let's, I think that's where that needs to go. All right, so what we need to do, Cindy, is grab that other bone clamp, come around cranially, other way, cranially, and then rotate the handle cranially that way, all the way around, keep going. Okay, and then just carefully, let's just have a look here. Okay, release it. Open. Okay, go ahead and try to grab it around. And very gently, go ahead and clamp. Okay. Okay. Release just a little bit.
Release a little bit.
Yeah. Okay, and then gently. Okay, a little bit more. Okay. Okay, then I'm going to take this one around the bottom here. All right, so that looks let's just lift this up a little bit. Okay, so I'm just trying to look underneath. Suction up there for me, please. Okay, I reckon that's pretty good. All right, so now I need to start doing cerclage wires around the femur. So let's get a few pieces about 15 centimeters long. Pin cutters, please. Just about kind of that long. I think there should be a pin cutter in there. I want to make sure that this I think that's pretty good. Just have a look and see where it has to be in the sharp bit. Yep. All right, so we'll get our I have a hemostat. Here we go. Just let's move that up a little bit. Just move that and then suction for me, please. Make sure I don't have a hole in my glove. I don't. Okay, and then I'm going to put my wire wrap caudally. The reason why I'm going caudally is because the quadriceps muscle rides on the cranial aspect, and it moves a lot more than the adductor on the bone. See how I go forward and then back just a little bit, because sometimes it gets stuck and it'll slip back a little bit. So we're trying to make sure that we get it really, really tight. Okay. Might be able to remove this one, put it there, make it easier to come around the back here. We want our cerclage wires. Those are a bit long. You probably can make them about A third shorter?
Yeah. Do you need another one?
I will need another one, yeah. So we want to put our cerclage wire somewhere between kind of 8 and 10 millimeters apart. And you want to pull tension on the wire as you're twisting. Grab that for me, please. Okay. Now I'm just going to see, make sure that I'm happy. Yep, that looks really good. Okay. That's good. Somebody's asking about pain relief. They said that they just fractured their own radius, and apparently, I can't read the whole thing, but apparently they're in a lot of discomfort. So we have this dog on a fentanyl CRI, and then we have ketamine available if we need more pain relief. And then we'll have it on paracetamol, meloxicam, and a fentanyl patch to go home. We'll give it methadone in-house. I'll put one more cerclage wire farther up. That's patella down there.
Nice exposure.
Yeah. We'll do a local block as well with bupivacaine before we leave. If you see me trying to close without putting in bupivacaine, can you guys remind me? I always believe in surgery by crowdsourcing. Okay.
When you say you're pulling the tension when you do the
So we want to keep tension away so that you get even,
kind of
yeah. All right, so I'm pretty happy with how that part looks. Now we're going to have to start thinking about reducing the fracture. But the issue is here that, you know what, I'm going to put one more cerclage wire around there distally because I don't want to break that shard off, yeah. I don't use loop cerclage. I just do conventional, just twisted cerclage. I have used them before. I think that the literature, when I was studying for boards anyway, suggested that the loop cerclages are tighter but weaker. So the initial result is that they're tighter than you would get with a twisted cerclage, but that the breaking strength with a single loop cerclage anyway is stronger with a twisted cerclage. All right, so now I'm going to try to grab onto this in a way that I make it maybe a little bit stronger, and then get my other bone clamp down here and see if I can reduce this thing. It's actually not too bad. Okay. Just have to be so careful that I don't splinter this. I'm happy that I'm able to reduce it at least close. Now, one thing that I could do would be to put an IM pin. I think that the main thing is going to be to just lift up. All right, so that's really nicely reduced, and I'm just going to put in one more cyclage wire. Come back out. Yeah. All right. No. And this wire is probably not going to provide any long-term strength, but it's just going to hold the fracture in apposition till I can get the plate on. So that has slipped. You might have to lift the leg up a little bit more. Okay. All right, now I'm just worried that I'm not going to be able to get my plate on with all those wires there. Might put another cyclage wire on distally. And then hopefully I can twist this one around the back a little bit because my twists are in the way. Like I just to find. Okay. So now see if you release that yet. That looks pretty good. Now we can get a plate. Let's have a look at what we're going to use. Possibly this guy.
Yeah, can we get some saline, please?
Where's my cautery? Just going to expose a little higher up here. Just exposing a little bit more on my greater trochanter. And we'll get a Homan up over the greater trochanter into the sciatic notch. Okay, hold on to that, please. All right, so that looks really good. I'm not going to compress this fracture because it's a short oblique. If we compress it, it's going to distract the fracture. I'm not sure what you hear banging noise. There's nothing banging in here. Okay, so got lots of room up distally. All right, so we'll have 3 screws. Let's see here. 3 screws distally, maybe. All right. Is that too much hardware, I guess, is the other question for this dog. Just going to loosen that wire and try to bring it around the back a little bit. That was a bit risky. I could have distracted my fracture. I'm just trying to make it so my plate fits a little better. Okay, so that's pretty good there. That's pretty good there. Let's see if I can get a longer plate in here. All right, so this is going to take quite a bit of contouring. That's okay. All right, so lucky I ate my Wheat Bix this morning. I don't think I think I'll be okay. All right, so now I'm just going to put a gentle bend. Okay, and then I have to do a fairly acute bend at the top. So release that. All right, so that's going to go down here. Like that. I think I have too much of a bend. Okay. So right about there. Thank you. It's really frustrating working on a plate for a long time and then you drop it. And I have done that before. So I'm always really careful to have somebody grab onto it. So you can see that I always have Cindy grab onto the plate with a towel clamp Okay. Okay, that looks pretty good. All right, so then I just have to bend the top over. Nice thing about locking plates is that you don't have to contour them as perfectly as we used to have to with just DCPs. Just flip this over. Okay, release that. Yeah, thank you. All right, so that's pretty good. I think I need a bit more. Okay, yep. Okay, and then I've got too much of a flare distally, so I'll just reduce that. Grab onto that, please. Okay. All right, so that's what my plate looks like now. Hopefully it's going to fit nicely on there. It looks like it is. Now I'm hitting something here. What am I hitting? I think I'm hitting the Homan. All right, so can I get a wire driver, please, and a pin pack? Wire driver and a pin pack, please. That's gone through, so we'll just leave that there. You know what we can do? Pull that out. Get rid of it.
Just watch out, that is dirty. So.
I don't need that. I just need a pin pack. Is in a roll, pin roll. I don't want to have this too far distal that I'm impacting the travel of the patella. So there's a question, should we absolutely avoid bending plates through locking holes? And look, ideally, yes. You can always use cortical screws in those positions. There's another question. So this is quite a big plate for this dog. And so I was thinking about whether we needed to put in a rod as well, but I think that it's more important for me here to get my screws in the proper position rather than worrying about load sharing. Okay, so let's get rid of that guy, and we'll just, let me see if I can get a bone clamp. It's sticking quite a bit off the bone there. What I'm going to do, what is that hitting? I'll take my, let's see here. And
This one is from the drill guard.
you sure? We're missing a drill guide, please. The locking drill guide for 3.5, we should have spares. Where does it normally go?
Yeah, it's kind of weird. It should have its place.
Yeah, so not there. I was definitely here yesterday. So we're just looking for our drill guide. And it's not out, or you haven't taken it out already?
No, I haven't taken it out.
Okay. Thank you. There should be a spot in here, but I don't know. You're right.
That's why it's not in it. I think yesterday we take it out from in there. That was program where we take it out. Yeah.
Okay, so let's get our chuck. Where is that? Did we not have it already? AO, a quick coupler, please. Thank you. 2.8. 2.8. Okay. And that, I could definitely tell that that was metaphyseal bone because there weren't two distinct cortices. All right, so this measures 4 on 0. 22, please.
22 locking.
All right, so I should be able to take out that pin. All right, and then just align things up here proximally. Okay. Can we get that pin back, please? Okay. Thank you. All right, so that's just going through the, actually I could go all the way through. So that's just going into the inner trochanteric notch. I just worry if I try to go all the way through, I'll go into the femoral neck. I think it did go all the way through. Take a 30, please.
30.
Locking.
30 locking here.
There's no way that a 30 could be getting all the way into the acetabulum. All right, let's go ahead and take out that pin.
Take all the pins.
Making sure there's no crepitus. There's no way that a 30 can go all the way into the joint. That's the ligament, that's the head of the femur right there. Can you externally rotate that for me, please? Just going to try to look around the front there.
And you got time if I want to go just a little bit like this.
Let's just get this home and around the front here. And All right, so I can see the bone there. I might, I'll put a shorter screw in, so let's just keep going. I'll get some more, take that out.
Shorter screw for the top one.
Yep, go ahead and take that out. Uh, 20, please.
1, 2,
See, that's not threading very well. So I'll have to put in a cortical up there. I'm just going to put in a monocortical there. So that'll be just like a 10. Let me just check. Yeah, just a 10 there. And I'll hand drive that. I've dropped it. Is there, yep, that's right. I just need that. Okay. Let's go over the top with our Homan.
place the cortical.
Cortical, yep.
2-8 drill. 2-5.
2, 5. Let me just see here. No, that's not threading. Yeah, so I'm happy with the 2, 5.
You want the 2-5 and this one is 2-5.
Thank you. And I'll hand tighten that one. Uh, 14, please. Cortical. Okay. I'm sure that one's fine. Let me just see if I can feel anything medially here. I cannot. Now I'm going to leave that one nice and long. Okay. So now back down here.
This 2-8.
Thank you. I can probably pre-med my next one. So that's a 20 cortical, please. Locking. 20 locking.
20 locking for your side.
Thank you. Roy. And the comment about an orthogonal plate or a pin, if I had used a 2-7 plate here, which I could have, then I would definitely have wanted a pin. A 20.
20 locking.
Yeah. And I'll just go and hand tighten all of these after. No, I'll power drive it and then I'll hand tighten all of them afterward. Okay. Okay, that's great. So now I'll just go back and hand tighten. This was 6.5, I think. Let me get some OPDS, please.
And the top cortical is because you feel like it's go into the joint.
No, because the top is cortical because the hole was bent,
Oh,
and so you can't put a locking screw in a bent hole.
right. It's the thing. Yeah. Okay. That makes
Yeah.
sense.
Now that is a bit stripped. Let's get our Homan back in there. So I'm going to go all the way through and through. Uh, 2.5, please. Although my first hole's already drilled, so. Did that just come caudal? Or is there bone there? No, there's bone there. 20. 24, please.
24, 44.
Thank you. I can feel it threading with the other screw, which is fine. Make sure it's
With the second one. Okay. go the hormone?
Hey?
Don't let go the hormone?
Nah,
Keep that.
it's come out caudally. It's gone through the greater trochanter, but then come out caudally over here. That's okay. Feel that?
Oh, just next to the...
Yeah. All right, so flush and suction. That's great, thanks. All right, so the most important part of our closure here is the patella. Need to make sure that that is going to continue to track well. Do you know where the brown Adson is? There. Make sure that the patella is tracking and that it's not going to luxate. Yep. We can go ahead and take that out. I'm going to trim a bit of this vastus lateralis because I'm afraid it's going to be a bit necrotic.
Is it because the color and it even...
Yeah, and it's just kind of macerated. Oh, bupivacaine.
Oh, yeah.
Thank you. Blair, can we get some bupivacaine, please? How much does a dog weigh? 17. So we will get about 17, about 6 mils.
Teamwork?
Yeah. So we're not actually going to suture to that muscle. That muscle has to be free floating.
This is one of the belly of the quadricep.
Yeah. And we'll just splash it in there. That's great. Thank you. Okay.
Do you need a new glove?
Yep. Can I get a new glove, please? All right, so we're not closing that. We're closing the fascia lata over the top of that. Thank you. Yeah. Can I get a new glove, please? Can you see that fascia lata there?
I can see
That right there.
This
Yeah,
one
so
here?
just start doing some cruciate sutures from there
but to just here.
to the biceps fascia. Yep.
Oh, this one here, sorry.
I beg your pardon? Yeah. Tiana has put a limit on the number of gloves I can use. So I've been through a few pair. But my hands are sticky. Sweaty. I'll just put in a few more anyway, and I'll let you finish up. Okay. So this guy here,
Oh, yeah. Maybe that's why.
and then
Feeling weird.
and careful that we don't make it too tight because you could create a compartment syndrome.
Yeah, not as quite inflamed.
Yeah.
Is that also the reason why we don't kind of?
You just don't suture that because it's meant to be fully mobile.
Oh yeah.
Yeah, the quadriceps slides.
Through the interfascial.
Yeah. Just pull that caudally for me, please. So that's getting into biceps fascia, or biceps muscle attached to the fascia. I'm going to make sure that we're not picking up that vastus lateralis there, or lateral head of the triceps. Sorry, lateral head of the quadriceps. Did we get our second dose of antibiotics? Yeah. Thank you.
Someone have a question about compartment syndrome.
Yeah.
Question mark.
So compartment syndrome, it's pretty rare in dogs. And it comes from basically having the muscle swelling within the muscle sheath, where the pressure created by the muscle swelling exceeds the perfusion pressure, and so you get necrosis. Can we get some more OPDS? So I'm closing biceps muscle there. To fascia lata. And you can use a Gelpy in there if you need to. Okay. All right, so then you'll just use sub-Q, like that, and then an intradermal, one or two sub-Qs and then intradermal. Just finish that up there as well. Yep. All right, so I'll just check to make sure that I haven't missed any questions. Hi from UAE, hi from Brazil, hi from Miami, Florida, Georgia. Good luck on your PU. Hi, Stephanie. Minnesota, Sudan, Mexico, so as far as coming and joining the team, it's like we don't have any positions right now, but you certainly can come and visit. We definitely have vets that come and visit periodically. So, yep, you can reach out to me and work that out. I think we answered your question there. Hi, another one from Brazil. Hi, USA. So the cerclage knots are pretty far from the sciatic because of the adductor muscle is going to be sitting on top of them. So it's probably 3 centimeters away from the sciatic nerve. Hi, Oregon, Egypt. Thanks for the bupivacaine. Paraguay, Texas, and Ecuador. All right, guys, thanks so much for watching. I think that was an interesting case. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. And we will talk to you again soon.